Oh, you just got.
Okay, guys, let's go ahead and do our in-service.
Okay.
But before we do that, I want to talk about call lights. I have records of call lights for the last week, and we have records for the south, the west, and the east. And so we also have an average. So this is all call lights for 7 days, and then it gives you an average of how long each call light was answered. Okay, so on the west hall.
Average is.
On the South Hall, I'm sorry. On the South Hall, they had a total of 742 calls.
Oh my God.
Over the course of 7 days?
Yeah, yeah.
Okay.
So they get a lot of calls,
Yeah.
and then they average at 2 minutes and 24 seconds. That's
To
pretty
wait
damn-
for
That's
the call.
pretty damn good. So,
Wow.
hey,
they only
for
have-
those of you guys that are,
They have less people
my
with
God.
that.
but listen,
my
but you
God.
listen
If
to how
it's
many
better-
calls they get though,
I
right?
know, but
742 calls.
Yeah, but
Right.
still.
Yeah.
Okay, the West Hall. The West Hall. The West Hall got almost the same. 734 call lights.
But we have 8 people all the time instead of 6.
Yeah, that's true.
That's not fair.
So the average of this one is 3 minutes and 52 seconds, almost 4 minutes.
That's still pretty good.
Yeah, that's still
It
pretty
is
good.
pretty
We're
good.
trying to be
4
under
minutes is
And it's having all
fast.
shifts, right?
Huh?
All the shifts?
all the shifts.
Okay.
All the shifts.
3 minutes and
Okay.
42 seconds.
So this one is the East Hall.
They have the least calls for
So
sure.
they had the least calls, 437 calls.
It's like almost
Yeah, that's like almost half of what we get from the South and the West. But they also are taking longer, 4 minutes and 12 seconds.
That is a long time.
So it's still pretty good, an average wise.
That's
but,
pretty average.
but still 4 minutes, and then there's only 400 calls in comparison to like the West and the South. They're getting 700 calls. You know, what I mean, so the East Hall. We're gonna keep doing this, kind of printing out the call light system to see what the average are.
We'd hit the flashing one first.
Okay.
Okay, let's go over this real quick, guys. There's a lot of stuff I'm gonna cover here. We're gonna go fast. Know your residents. So today's service is about roles and responsibilities, right? Whether you're working AM shift or PM shift, we're just gonna go over some of the things that we should know here at Seacrest. And some of these are specific to Seacrest. It doesn't have to be like, oh, this is what we do for every single CNAs, but these are what we expect what our CNAs should be doing. In terms of like your day to day, like getting residents up, showering, and all that. So know your residents, orientation, obviously. Know, and when you're dealing with your residents, know that they're oriented times 2, 3, or 4, right? Person, time, place, situation. If they're confused, if they're orientation. Patients that are dealing with orientation, you're gonna have more oriented resident. You're gonna have more issue, right? Like they're gonna be calling more, they're gonna be asking more questions. In comparison, if you have somebody dealing that's confused, you might have more issue too because they really don't know what's going on. They might have some confusion that's gonna make them more anxious, right?
Jenny had it. I don't even
So-
know the paper.
So know your residence orientation, transfer abilities and requirements. If they're new patients, obviously know if they're 2-person, Hoyer, easy stand, whatever, right? So that's just good for your back, good for the resident safety as well. Special needs and ortho needs. Some patients need braces, TED hose, foam sleeves. So these are things that we should know before getting residents up, and we need to figure that out. Also, residents that might have a Foley catheter, right? Know when to switch from leg to drainage bag. Does anybody know what that means? Like when do we switch from leg to drainage?
If they're out of the bed.
Yeah, when they go
In their
there.
chair.
When they go to bed and drainage, and then vice versa, right?
Yes.
Right, when they're
Specific.
okay, that's good. When I was visiting a facility the other day, they didn't know what a drainage bag was, and they didn't know what they just thought like, oh yeah,
Catheter.
yeah. They're like, I'm like, oh, is that what it meant? I'm like, yeah, that's what it means.
Gross.
Know the importance of EBP, enhanced barrier precaution. We know that if somebody has that sign, we need to wear at least gloves and gowns when you're dealing with, especially Foley catheter and draining Foley. Placement of bag within bed. Where is the bag supposed to be when you're laying in bed?
Down towards the
Toe,
feet.
foot of the bed.
But
What do you mean where?
the Foley catheter bag,
Yeah,
drainage
well,
bag, when
on
they're in
the
bed.
side.
Below the side.
On the side.
Below the what?
Below the knee, I think, but
Below the knee?
yeah.
What's the right phrase? Not below the knee, it's below the
Body level, below the waist.
below the bladder, right? Yeah, below the waist,
bladder.
yeah. But like,
Yeah.
right? So it could be below the bed, but like it just gotta be below the bladder because he has to
Okay.
drain out.
It has
But you
to
just can't be above it because then that urine will go
Right.
right back to the bladder. Okay. What is a freedom bag? Does anybody know what that is? What's a freedom bag? Freedom bag? Freedom bag. Freedom bag is when you have a drainage bag and you wanna put the bag inside the drainage bag so you have it concealed. That's called a freedom bag.
Oh, the blue one.
Yeah, the blue bag. Yeah, yeah, yeah. What do we call those? What do you guys
They
call them?
changed it, huh?
What do we call
Well,
them?
it's
A
a cover, it's
dignity
almost like
bag.
a
Isn't it a dignity bag?
Dignity
Yeah,
bag
yeah,
and
yeah.
freedom bag. Yeah, yeah, yeah.
Yeah.
So yeah.
They
So
call it
the
freedom
dignity
bag
yeah.
That's funny.
Yeah. Freedom bag or dignity bag. You're right. It's dignity bag or
Yeah.
freedom bag. Yeah. What should you do after emptying a drainage bag to decrease the risk of infection? After you empty like a Foley catheter, what are we doing to decrease the incidence of infection?
You clean it.
Clean it.
With what?
Like,
With what? Alcohol. That's right. We kill it with we kill it with alcohol. Right. So you drain it and then you clean it with the alcohol wipes. Okay. All right. IV. Reason for IV. You should know why they're taking IV, right? Is it a hydration or is it an infection? How do you dress a patient on IV? Can you dress somebody on IV? Yeah? How do we do it?
Well,
What should we do?
You work around, when I have you, I worked around where she got that IV, cause she had it right here, well, she had it in the middle of the feeding tube though.
Me too.
That's
Okay.
the thing.
IV, guys.
I
What do we do for IV?
You just press them like it's an affected arm or something.
Yeah.
I don't know what
You
like
can't. You can't because IV is hanging, right? You have to ask your nurse
Yeah.
to stop the IV.
There you go.
Oh, I see.
Yeah. Or if you have, if you put in the bed, you could rip one of those that has little like buttons on the side.
Down.
Those are
Down.
specific for IV.
Yeah.
Yeah, right. It goes around the IV. Yeah. So that's it. Yeah. What are signs that we should be looking for that indicating that we need to tell the nurse, hey, there's something wrong with this IV? What do you think? What are some of the things that we should be looking at?
the areas like red and
Red,
Yeah.
irritated, bleeding, pain, fever, occluded,
Swelling.
beeping, yeah,
And swelling.
swelling, right? Right? So, what are some of the concerns that you have for somebody who's on IV, by the way? Because when I was a senior, I was like, what the hell is this? I'm not playing with this. It's stuck underneath
It coming out.
Stuck underneath your
Yeah.
skin, right?
And
Coming
having
out
them
there.
pull it out.
Is it pretty scary for when you're dealing with that, or not really, right? No?
Like
What
she
concerns
said,
you
I have
guys?
to be careful around
Right.
it.
Yeah.
That's the thing. But you're getting like snagged.
Yeah.
It's like, oh,
Yeah.
yeah. That makes
Is
it
that-
right.
Yeah, it could be concerning, right? Like, so when somebody has IV, but call your nurses, they can put a stop to the IV, you can do your changing or whatnot, and then you can rehook it up. Sometimes your nurses are busy and they might give you a lot of, right? They might not get what you want, but just let them know, I gotta get this patient out. If you don't mind stopping the IV, I can get them changed, right? Meals, best practice is that all residents should be in a dining room. Some residents request to be in the room though, right? Then you have that choice, right? How do you set up a resident in the room, right? What is the most important thing? While they're in the room, in terms of, safety and customer service.
Hold them up in bed.
Hold them up in
Hold
bed,
up so they're, yeah,
Degrees,
folded
and-
right, and they're sitting 90 degrees.
Make sure they have a
90
collie.
Make sure
Uh-huh.
they have a call
Yeah,
light.
make sure that the table's in front of them.
Such a
Yeah.
beautiful-
Yeah, yeah, and some of the
Make
tables,
sure
even
the
though the
back's
tables are
down.
leaning, make sure this one is standing upright.
So what'd you say?
If they have a floor mat, make sure it's down.
Yeah,
Mm-hmm.
yeah. What else should we do for this patient who has it? We just gave them their food, right? What else can we do for them? Because we had a complaint the other day.
Uncover everything.
Yes.
I
Yeah,
always-
we
always
keep getting that. We have a resident who's oriented. This is what I'm talking about. Like if a resident is oriented, know if they're oriented or not. Even if it's you, we shouldn't be leaving patients food with like uncovered. There's like plastic still on there.
No, I
You
know,
put them
they need-
right.
Uh-huh.
First we think of safety, aspiration. Make sure their head is up, right? Make sure they're elevated. Then you want to think customer service. You want to prepare everything before you leave. You can't just be like, hey, here you go. I'm sure you can open everything up when you're on. I'll see you later. You need anything, right? Open
Or at
everything
least
out. Check
ask
the plan.
them
Ask it,
to-
right? Can I open this for you, right?
Right.
Right? So that's what we need to do. We
I
need
feel
to be
like sometimes
thinking.
when it doesn't happen though is when people are a little bit busy, cause some of like, the Westfall has like 9
Yeah.
trays every single time. And there's
9
like
trays.
so many things.
So much little things in there.
Yeah, that's why I feel like sometimes that could happen too, where it just gets missed.
It
Like
gets
I'm not
missed.
making excuses.
Yeah,
for
it
that.
could happen,
Like,
but
yeah,
like,
it could-
I served,
miss-
I
getting
served
missed is
so
fine.
much going on.
Intentionally leaving it unwrapped is not
Yeah.
good, right?
I haven't had
So,
a problem, but it happens.
No, but there's a lot of trays, is
There
what
are
I'm
a lot
saying,
there.
yeah.
the condiments too that are missing, so those are gonna be, that takes up a lot of time.
Yes, I
Right?
they want it warmed up
So-
again.
Alright.
Yes, right.
And then what is aspiration precaution? What does that mean to you guys? We talked about this one already in some of our huddles. Aspiration precaution means what? How do you, you're monitoring for choking, right? you're elevating, you're making sure that they're tolerating their meal, and then you're reporting if they're not tolerating their meal or their coughing, okay? Showers, talk about showers. All showers are documented, signed off by nurses, right, in that little sheet of paper, right? All your residents, even if the ones that are showers that are provided by hospice, these are still our residents. We're responsible for documenting the showers. So you can even give it to the hospice scene. Hey, here, fill this out, right? You're giving the shower, fill this out, have the nurse sign it. But we also have to put our matrix, right? We're getting requests from family members, hey, when was my loved one showered? And if it's documented, we can get a report on it.
Yeah.
Like how often we get them a shower, okay? So make sure that we are indeed doing all that, you know. If the resident refuses, you know, we have to offer a bed bath, all of that. What are steps to encourage residents to take showers? Return back for multiple times, offer shower at a convenient time and shift, not early. Have another nurse or CNA assist you. Call family and ask for assistance sometimes. Right? If you have a patient that's very difficult and not wanting to take a shower. When hospitals provide showers, we talk about that already. Snacks. Snacks are scheduled for what, 10 and 2 p.m.? Pass snacks and assist resident as well as document how much snacks was consumed. Why are residents offered snacks? What's the importance of snacks?
But they're losing weight.
Yeah, they're losing weight. These residents are not eating.
Nourish them.
In the dining room, how much do you think they eat? How much time do we have with these residents? Sometimes we just give them one spoonful, and then they're like, I don't eat anymore. Yeah, and then they're not hungry yet, right? Because they're literally just sitting in their chair, and they may not be hungry in the morning at 8 o'clock. It comes 10 o'clock, they might be hungry, and that snack is going to be really helpful. And yes, every day we talk about residents losing weight, and so snacks is gonna help them with that. If snacks are not consumed, discard and run matrix refused. When things break or get broken or things are pose a threat for safety, what do? Fill the yellow form, we get it fixed, right? Some things are fixed by maintenance, some things are, you know, from housekeeping. There's things that like Gurley has to call or Viviana has to take care of. But definitely anything that's like wheelchair related, anything that's like fixtures and stuff like that is mostly maintenance, right? Beds and stuff like that. Housekeeping will take care of like curtains, what else is it housekeeping take care of? Soaps and stuff like that might be broken, I think, that's still maintenance. I think they replaced the soap. So, but Hoyer lifts and stuff like that, that's Viviana and Lily's department. Okay, how to report change in condition? Verbal report, and then what else do we do? What else do we do that kind of saves your butt?
Documented.
When you have a change in condition,
Oh, it's like
there-
telling the nurse.
there's a piece of paper that we fill out, right? There's a red piece of paper that we fill out. There's a change of condition, you fill it out, you verbally tell the nurse, and then you can bring that over to the nursing station. Hey, I told nurse so-and-so that there's a change of condition. She's not really waking up and blood pressure is low. And maybe you've had a history with this nurse where you tell them something and they're not following through. So, and they can turn back around and say like, Raquel never told me nothing, but hey, you know what I did, because I wrote it on a piece of paper, okay? So there's a change of condition. Provide written report to a resource or not clerk. If that doesn't happen, you can drop it off in my box as well. End of shift report, make sure all rooms are clutter free, all beds are made out, all trash removed from room and hallways, no bag trash on the floor, empty all dirty linen and trash bins in hallways, right? We can't leave those bins filled out for the next shift. Wheelchair rooms should not be cluttered, right? We gotta keep our rooms nice and clean. And in the morning or in the afternoon, like when we're giving showers, especially in the morning, right? Patients are getting up. I know we're busy, but we gotta fix those beds right away. You know, because it looks cluttered, it looks messy out there. Leg rest, yeah, when you're going home or change shift, make sure that the leg rest is actually put aside on top of the wheelchair. Avoid extra linen in the room. We don't need to be adding stuff on there. Get rid of it if you're not using it. And then resident in bed should be pulled up and chucks are appropriately placed and not underneath their heads, right? Sometimes we come in and we're like, man, look at these chucks, they're way up here, way up in the back. There's nothing down here, and they're incontinent and they're peeing all over the bed. And so that needs to be addressed if that's an issue. Charting should be completed 15 minutes after your shift ends to prevent audits. Vitals and outputs are pertinent data to prevent extra meds. So that means that you need to be putting in patient avoiding and having bowel movements. Alright, chart as you go to prevent late charting. Report who was given suppository, decreased meal fluids, low BP, etc. Right? If you have a chance to give a report to your incoming CNA, that's what you would be reporting. What else would you be reporting? Adding in the report? What else can you put in there? Skin tears, yeah, behavior. This patient was yelling and screaming, didn't want to take a shower. You know, I mean, he was given an Ativan, yeah, and sometimes Ativan, you give Ativan, you hope that they're gonna be more relaxed. It goes the other way around. You know, they have an allergy to Ativan, and it's crazy.
We don't have a
Communication.
spot to put other though, do we?
What's that?
We don't have a spot to put other.
When we have matrix upgrade, we're gonna have a whole lot of stuff to chart on.
Oh, when is that?
Yeah.
Hopefully in the next month or so.
We get to
Yeah.
chart more.
Yeah. Communication and registry, communicating with registry staff in a positive manner is always really good. Help us build strong teams with partners. We'll encourage registry to return. Basically, to help registry through a verbal report is informing them which residents are oriented, where they are for meals, resident commons level and mobility needs. Also, you can direct them over to the nursing station, have them talk to the clerk. There's a little census that's made up for them, right? It's got everything on their residents on it. And the clerks do a really good job of updating those. Communicating with residents, assess if the patient has hearing difficulty or visual difficulties, right? If this is not addressed, communication can quickly fall apart. Assess if the patient is having pain issues. Unrelieved pain can cause anxiety, resentment, behavior issues. And then assess if the patient is incontinent as wet or a bowel issue, right? And cause restlessness or anxiety. So it's really, really important to make sure you know who you're dealing with in terms of residents, right? Try to figure out why they're anxious or they're mad or why they're having pain. Okay. Therapy. Most of your patients in the South Hall or new admits will require therapy. Prepare these residents before 10 a.m. So that way they can do their their therapy, right? If they refuse to get up, the minimum should be dressed fully, right? New admits, we talked about this already. Are CNAs allowed to get new patients up without first being seen by a PT?
The other day you said yes.
Is that yes or no?
No, before?
Before.
Yeah.
Depends.
Get him up? They have
No.
to see
Can
him.
you get them
Have
up?
to
Can you
them
get a
ready.
resident? If the resident wants to get up and use the bathroom, right? Maybe they have a hip fracture and it's a Friday night,
No, Becca.
huh?
Well,
Why?
you
Tell me
can't
why.
deny it, but no.
Tell me why, Fernanda.
Well, I'm gonna make
Fernanda.
an educated guess. I don't know, but my guess is because they haven't been evaluated. You don't want to risk it. If you hurt the patient, you're gonna be a.
So
you know?
now the patient's been sitting here for Friday night. It's Saturday morning. It's Saturday now, all day Saturday too. You come in again.
Right.
Hey, Fernie, oh, you're such a good CNA. I like your hair today. Can I get up to go to the dining room? I really want to hang out with my friends in the dining room.
I mean,
Yeah,
you can't say no.
What would you say, Fernie?
Yeah.
I'm putting you on the spot.
I would be so polite and be like, you know what, as much as I would love to get you up, I cannot get you up, and just, it's my choice.
Oh, you're not gonna say,
Charming
well, thank you
personality.
about my hair. I just got it
Something else,
done.
why don't I invite somebody in to come and talk to you,
No,
But
okay.
no,
So,
for precautions, for safety.
huh?
I could do 2 people.
Yeah. So, guys,
Yeah.
any new patient, especially
I don't know.
new admins, right? If we need to be getting them up, right? What you can't do is walk patients around, right? Your nurses, they get paid good money, right? Because they went to school for certain things, right? Hip precaution. We know what a hip precaution is. Somebody had status post hip surgery. We know what hip precaution is, right? It could be, and there should be an order in there. Even if our physical therapist has not seen them, we know what of non-weight bearing is. We know what 10% weight bearing is. We know what toe touch weight bearing is, and these are typically orders for status post hip surgery, but also knee surgery, right? Maybe it's done weight bearing, but we know how to transfer resident. There's 2-person assist. There's all kinds of stuff that we can do to transfer. We shouldn't be walking the resident. You're right? We shouldn't be doing that. But for transfer to use the bathroom, for transfers to go to the dining room, we can do this for these residents. Okay. If they sit around for 72 hours, maybe they've been doing that in the hospital, right? Sitting around for the last 24 hours. And then now they're sitting around for another 48 hours. You can get an infection, right? You can have all kinds of issues in terms of resident just laying around. But if a resident, and I get it, I get anxious too, like as a new CNA, or not even a you CNA, you have a you patient that just came in and I don't know how to transfer you and you have this surgery, you got a bone just sticking out in here, I don't know what to do with you. Go get your nurses, right? What are the orders? This patient wants to get up. We got status quo hip surgery. We're skilled nursing. We have a lot of nurses there. We pay them good money. They better know. They better know what to do with that resident. I'm gonna be really upset if we're like, oh yeah, hip, no, I don't know what to do with that.
With
No,
the
that's
bone
what we
sticking out,
specialize. This
you
is a
need
skilled
to-
nursing. We know what to
Just
do.
saying,
We know what transfers mean, right?
I mean,
Two-person transfer.
I
Even
don't
if
wanna
they,
get up.
even if they have a broken right arm or a broken right leg, we're gonna get this patient out. We know what to do, right? They're having pain, and they still wanna get up. Yeah, we can get you out. Let's get you some pain meds and let's do hip precaution. Let's apply this. And make sure we're getting them up. Okay? But we can't say, no, I can't get you up because you haven't seen bathe therapy. No, we can. We can get you up. We can get to the dining room, use the bathroom. Walking around, no, I can't do that. I can't walk you around. Okay? And so, so that's the thing. Okay? New admits, CNAs, okay, how, what are the most important factors for new admits and what? And why is it important that we get these people up? I just mentioned it, right? You can be in aspiration, right? If you're not using your ability to swallow, because you're just kind of laying down, you know, things get kind of weak, and you can aspirate, especially when you're laying down like this, right? Things get stagnant, you get constipated, right? You need movement in your stomach to make things flow, right? If you're just laying around, you're gonna get constipated. You're taking narcotics because you're having pain, and now you're not moving around. Oh yeah, you're gonna get backed up really bad, okay? And so also you're gonna get swelling, right? Status quo surgery. If you're just sitting down and that foot is just sitting there, not moving, all that stuff can just sit there, right? Fluids, infection can start brewing. So we need to be moving these people. Beds and safety. Beds should be low position. Alarms should be activated, right? We've been hearing people deactivating the alarm. If this is going on your shift, please let me know. Especially if you're coming in from a PM shift and then the AM and you notice the alarms are off, or vice versa, right? You're coming in from a morning shift and then on night shift, like these alarms are being turned off. So that can't be. It can't be. It needs to be activated. Bed remotes and TV remote within reach and not wrapped around bed. Bed should have gap in between walls to prevent fire and damage. So unless you have an order that says, hey, this patient is a fall risk, and the bed is against the wall, right? There's an order, consent for that. Otherwise, there should be a nice gap right there. Fallish residents should have a fall mat too, like if they have an order for that. So remember that if somebody is still walking and having a fall mat, that increases the risk for falling down. So the fall mat is reserved for people that can't walk anymore. Morning CNAs consider showers before assisting up. If not able to schedule time, tell the resident, hey, I can't give you a shower right now, but you might be scheduled to shower at 11 o'clock or 12 o'clock or 1 o'clock, right? It doesn't have to be in the morning, but it has to be communicated, right? Because you might have an oriented resident that gets a shower every morning before breakfast, and you're coming in and you're just like, oh my God, I don't have time for anything. I just gotta get you up. I gotta take a shower. Oh no, you're not taking a shower right now. But you're gonna be like, you know what, I'm really busy right now. I don't have time. And we set up a time, right? Yeah, so we need to be communicating that. Grooming and dentures, check that they have dentures and things that need to be applied in the denture, right? Yeah, some of your patients are just like, they're talking and their teeth are falling out. And so, make sure that the dentures are very, I'm very animated. And so oral care should be, here's the thing too, issue with oral care. Make sure we're providing oral care after each meal, okay? And patients that are pocketing, know your patients that pocket, like after a meal, make sure you're checking over that. Sometimes they come out of the dining room, we're so busy, we're taking out the dining room, we go to here and they're sitting there for a while and they start feeding their mouth, right? So if you have a patient that pockets, go over there and check them out, right? Same thing, if you're feeding the resident, you know they pocket because you fed them, right? So before you take them out, make sure everything is swallowed and gone, right? So it looks bad on our end because we have these residents that still, like 2 hours later from a meal, they still have, you know, whatever French fries is stuck inside. What are steps to do? Okay, how to address patient with left side weakness for a surgical side. What do we do with a patient that has a surgical or broken like right arm?
The dress on?
Yeah, how do you dress
Put
it?
it on the weak side first.
Weak side first, right? What about taking the clothes off?
Yeah,
So it's strong.
The other way?
Strong
Side
for
first.
strong side for strong, yeah.
All right.
It got strong.
And then what type of clothing should be recommended for contracted residents?
What's a contract?
Yeah. loose, like
Gown.
Oh, like this?
Yeah.
Okay, so,
loose, bigger clothing, right? Yeah, something stretchy. Yeah, Gordon. Symptoms of pain. What are symptoms of pain for the resident? Somebody's having pain. What are you gonna do? What are some things? What are some of the steps you're gonna take? Ricky, tell us. You have a patient in room 15B having pain. You just came in.
Tell you.
Maybe you just came in, right? At the beginning of your shift, and he's having pain. What would you do?
Notify the nurse, take vitals, those are the main ones, and
Yeah.
then go from there.
Just think about what pain, what cause pain. What
Oh, yeah, ask
tell you.
them
The
what
position they're on, maybe they're uncomfortable, the position they're on, you know, the neck, maybe the whatever.
Yeah. But that's a good one to Ricky. But as a CNA, first we figure out. I just
The
came in.
discomfort, yes.
Maybe they're constipated. You got here. When's the last time you had a bowel movement?
They get mad when we ask that. Some of them are like, how many, right? They're like,
Yeah.
you
How
have
dare you.
Except we get that question all the time.
I just took a dump.
Yeah.
Okay. So, or maybe they have a cramp. Sometimes, like patients, literally, like I'm having severe pain on my leg. Well, you have a cramp, right? I just have a cramp. Yeah, I just got to massage it and move it around, right? So try to figure out what's causing the pain. They can be constipated, right? Or they might just be that status quo surgery, right? They
You know,
get pain meds
For
every 4 hours.
Beatrice, we figured out that when she hollers sometimes, it's because she's swollen, so we just go in there and we just reposition her, we change her, and
Yeah.
she'll kind of calm down. She'll still like,
That's what pain.
like say hello and all that stuff, but
Yeah.
it's not as much as other times.
Yeah. Yeah, because knowing your patient is really important. Okay, breakfast and lunch assignment. CNAs are either stationed on the floor or dining room or RNA. So there's 3 different places. How are each station different from one another during mealtime? Does anybody here new? We all know what we do during mealtime. Right? There's 3 different places where we could be. Reasons to get your residents up in the morning to attend breakfast. You have therapy, you have weights, prevent infection, UTI, pneumonia, increase circulation, decrease constipation, decrease depression, interact with staff and residents. So these are reasons why we should be getting our resident, especially early in the morning, right? Verbal response to resident if they refuse to get up. Remember that each resident has a choice to stay in bed, but we have a duty to get them up so they can improve their health, right? Would you like to go home sooner? Some of the things that you can tell your resident, would you like to go home sooner, right? Then getting up out of bed will increase your strength, you can decrease chances of infections and pneumonia, and then all the other reasons why you should be getting them up, right? Because sometimes residents are like, I don't wanna get up, like, come on, man, get out of here, I don't wanna get up. But we gotta get them up. Important info prior to PM shift, get reports for new admits, as admission occurs during mid-morning or afternoon. Know your showers and vitals. Prepare residents for PM dinner. Some residents do well with shower before meals. Most prefer showers before going to sleep. This is for PM. I mean, Rosalinda has been in CNA for a while, so she knows. Fall risk residents. Most residents with Alzheimer's will have increased confusion. What is the reason for the confusion? Usually, sundowning, right? So, any questions about anything, guys? I know I went through that real quickly. For some of you guys that came in kind of late, we went over the call light system, where the South Hall had a total of 742 calls, and they averaged at 2 minutes and 24 seconds with their call light.
Over
Who did the
7
South Hall?
days.
2 minutes and 24
Over
seconds.
7
Yeah,
days.
Who won?
This is for a whole 7 days.
Who won the competition though? You said?
Well, yeah, so that's, the
West-
South
the
did really
West.
well, 224. The West had 734.
It's like
And
the
then
same
it
as
took
the
the,
summer.
Call lights?
yeah, call lights. And then they got an average of
Crazy.
352. But here's the thing, the East is lagging.
Oh,
The East is
what the-
lagging. They only got like half of the call, only 437, but they took them 4 minutes and 12 seconds to pick up the call lights. And I think one of them was this call light right here. What the heck is this? Is that 1 hour?
33.
Is
1
this-
hour.
No, time. Oh, that's a time. Yeah, it doesn't tell you when.
1 o'clock.
Okay, yeah, it just tells you the time, yeah. But yeah, I think that's still pretty good overall, within 4 minutes, the
John,
average.
Yeah, that's
What's
really
the
good.
national
I
average?
bet it's terrible.
I don't know the national
Trivia
average.
question, Anna.
Yeah, I'll try to figure out what the
I'll
national
Google
average
it.
is.
There you
Google
go.
it.
Ask,
I'll-
that's right, ask
ChatGPT.
Alexa.
Yeah, literally.
Yeah. I'd like to know what the average is, even just around San Diego, I'd love to know what it
There's
is
a
at
national,
Village
there's
Square.
there's a state, and then there's a national average.
Okay.
Yeah,
I just like to
mean,
know if we're doing better than the national average. And even in terms of.
Don't look it up,
public.
don't look it up then, cause we're, just said that we're doing better. Okay.
Raquel, do it for
Okay.
me. Okay. Do we have to take this test and hand it
It's
back to you, or
5
take
to
a test
10
now?
minutes, so it's not even like.
10 minutes?
5 to 10.
Yeah.
So
5
we
to 10
are, give
minutes.
you like a better read.
Okay, so we should turn this test into you?
But
Yeah.
the west
Yeah.
has
Okay,
as
so
much as the
make sure,
south.
can I turn it into you later?
Yeah,
I think we shall.
Look at Raquel, still not happy about the West.
I'm not happy about that.